Sounds good. All right. So just give me all right.
Great. Good afternoon to everyone, and we're really excited today to have you join us for this very special presentation by Dr. Latif Murji, who is going to lead us through this session today. Dr. Murji is the physician lead of the VaxFacts Clinic and coordinator of global health, diversity, and health equity at the Scarborough Health Network. And he's a lecturer at the University of Toronto and founder of the not-for-profit organization, Stand Up for Health. He practices family and emergency medicine in rural Ontario communities, including remote Indigenous communities. And as we move to the next slide, I wanted to start by acknowledging where we are today. The land on which SickKids operates. For thousands of years, it has been the traditional land of the Huron-Wendat and the Petun First Nations, Seneca, and more recently, the Mississaugas of the Credit River. Today, indeed, Toronto is home to Indigenous peoples from across Turtle Island, and SickKids is committed to working toward new relationships that include First Nations, Inuit, Métis peoples, and is particularly grateful for the opportunity to share this land in caring for children and their families. And so welcome to you all today, and we do look forward to a wonderful session, which will be, at least a part of it, will be interactive. So Latif, thank you for joining us today.
Thanks, Dr. Allen. So to those of you who were at my previous talk, welcome back. This is another edition of Conversations in Vaccine Confidence, and this is the kids edition. So we had a little kid draw that, and hope you like it. Those are our social media and website. Again, so we're going to start with about 10 minutes that just reiterates what the VaxFacts Clinic is. So for those of you who were there last time, this part is a repeat, but after the first 10 minutes, we're going to really dive into specific types of pediatric vaccine hesitancy, and that's going to be all new. And this time, we're going to be able to get into breakout rooms and really have an interactive session. So I hope everyone's ready to participate and get that practice in. So practice makes perfect, right? So this is a safe space for you to do that. So again, it's the what, the why, and we'll talk about motivational interviewing again. So let's get right into it. So VaxFacts Clinic is a resource for you. As you may know, this is a first of a kind physician-led clinic in Canada that is centered around providing information and guidance around the COVID vaccine, specifically to patients who have questions, concerns, and are hesitant. They are able to talk to a doctor one-on-one in a judgment-free confidential space for about 20 minutes at a time. And VaxFacts is not just a clinical service, it's actually a movement of vaccine education. So we're going to get into that later. We're actually trying to get that knowledge out from multiple angles, take a really broad approach. That little pic there is of our booking module. So on shn.ca/VaxFacts, you can scroll down and see that calendar where there's time slots. So it's a pretty seamless and frictionless booking system where you can click a time slot, put your name and phone number in, and you will be called by a doctor. You're booking directly into a doctor's calendar. So it's pretty cool. Patients like it. And just a heads up, we're actually coming out with a separate stream for the VaxFacts Clinic that is specifically geared towards the Black community. So they will be a Black physician available for patients as well in the very near future. So why did we start the VaxFacts Clinic? So this was about April, May of 2021. This was, Scarborough was like, really being hit hard by COVID. 16 out of 17 of our communities were actually hotspots. And we know that Scarborough is made up of racialized communities, frontline workers, multi-generational household. It's one of the most diverse communities in the world. And this comes with a higher likelihood of getting COVID and also a higher likelihood of being vaccine hesitant. So we knew we really had to be ready to have these conversations and inform our population so they could make the choice to get vaccinated. So that was the origin story. And because it was so well received in Scarborough, we actually made it available to the broader community, first Toronto, then all of Ontario. And then because, as I'll mention, we don't require OHIP as our way of removing barriers, that actually allowed us to pretty easily scale to the entire country and provide our unique services to everyone in Canada. So a little bit of our VaxFacts stats, and this is as of a couple weeks ago. Just direct your eye to the bottom right corner and you can see that out of over 1,500, I think it's over 1,600 at this point, patients that we've seen, we're at about 83% of patients choosing to get vaccinated at the end of their appointment. So this is the success I was talking about. We're really proud of this and we hope to keep rolling with this. And the movement that I mentioned is beyond the clinical service. So we do have our doctors speaking with patients every day. We also have a whole team working on getting the information about the vaccine, the facts about the vaccine out to the community. And because we have the internet, these facts actually reach every corner of the world, and our community is really more broad, right? So we actually are having community events. So this is more local, right? We have outreach. We actually have boots on the ground that partners with local community agencies, religious groups, businesses. We have community ambassadors spreading accurate information about the vaccine. In terms of the events, this is an example of an event. I've had talks like this that are geared towards more of the general public and sometimes towards kids and parents. We've had town halls and Ask Me Anything events in high schools. And then the two pictures there depict that our social media efforts, and we actually have U of T medical students kind of championing and leading the way in terms of our social media. We have both Twitter and TikTok that we recently launched. That's the one on the right that you see there. So we went out and filmed a bunch of funny things, and these are reaching a different audience, really getting the facts out to different types of people in fun and informative ways. And then what is it about VaxFacts that seems to work so well? I would argue that a lot of it has to do with the health equity lens that we brought forward from the design of the clinic in the first place. So we want to make it accessible. We want to remove barriers, which, having it 7 days a week, starting at 9 a.m. to 8 p.m. makes it pretty accessible to people who are working 2 jobs or different types of hours. Our physicians are diverse. They represent the diverse population of Scarborough. We have over 200 languages available for live interpretation services. And as I mentioned, we don't require OHIP. So that barrier is removed as well. Anyone can speak to a doctor at VaxFacts Clinic. You just need to have a phone where we can reach you. And then secondly is we use this technique called motivational interviewing, which is, again, what a lot of our talk is about, how to have these types of conversations. So what is motivational interviewing? And this is a review for those of you who were here last time. Again, every person has intrinsic motivation to change. It's just about tapping into it. So every person has ambivalence about different topics. There's mixed feelings. And the counselor, you are acting as a guide. So you're taking the best parts on one extreme of listening and on the other extreme of instructing. And you're finding the middle ground to guide your patients and tap into the positive part of those mixed feelings, of that ambivalence, and really helping the patient see that for themselves so they can choose themselves to change. And that the spirit is actually very important, right? It's a partnership. You're actually sharing in the expertise and power in this relationship. You're not paternalistic and telling someone what to do. You accept that the patient has autonomy. They're actually the ones making the decision, keeping it judgment-free, affirming their strengths, having compassion, having empathy, and evocation, where you actually are inviting, being open, and inviting your patient's views, knowledge, and opinions. So with that as your spirit, now there's certain skills that we want to make sure that you have. And as I mentioned before, there's different frameworks that could be used here. They all are basically the same thing. So this acronym that we're using is ORS. So the O is an open-ended question. So you want the patient to kind of talk and share with you about where they're at with the vaccine. So that's actually, a question you could ask. You could even ask, like, on a scale of 1 to 10, where 10 is my sleeves already rolled up. How likely are you to get the vaccine, or how are you feeling about the vaccine? Or what do you think about the strengths or the advantages of vaccination? Just getting the patient to kind of think out loud, and you can see where they're at in that sense. Affirmations are where you're encouraging the patient and highlighting their strengths. So you're really doing your due diligence by calling and talking to me about this. That's great. Or you already have a lot of knowledge. Let's see if we can fill in the gaps, because you are the expert, right? So you clearly care a lot about the health of your child. So, it's great that you're coming to me to speak in more detail about this. And reflective listening or summaries, that's where you can demonstrate your understanding and allow the patient to add nuance or correct anything that they might have just said, or that you're trying to reiterate. So the simple reflection is where you're just saying back to the patient what they said to you. And a complex reflection is where you are trying to say back to the patient what you got or what they meant when they were speaking to you. And when they're able to add nuance, then you're really able to get on the same page. So this step is very important so that there's no misunderstandings. And then the elicit, share, elicit. This is where you're asking what the patient knows, and then you're asking permission for you to share on the subject before you actually share, so that they're ready for it and they give permission for you. And then afterwards, you verify what the patient has understood. So can I share with you what I know about vaccines and a little bit more about the science around them? That's a way that you could propose that. Let's just keep rolling here, because this part is all a repeat. And we're just about to the end of that. So the last thing that I want to remind you is that when your mental frame going into a vaccine hesitancy conversation, or we call it vaccine confidence conversation, is that your goal is not to get them to say yes. You have more basic goals than that. Okay, you just want to affirm and reaffirm that you're an ally. You want the patient to know that getting vaccinated is their personal choice. You're not there to force them. You're just there to support them. You have expertise. You're trying to support them. It's that simple. You want to establish that you want to validate before any persuasion. Being an ally, validating is really important. And your goal is not for them to accept, but rather for them to just be in the contemplative stage of change. That's already a win. So if you have this outcome where they're rolling up their sleeve at the end of the appointment, if that's your goal, then you're going to be disappointed. And it's also going to be counterproductive, because you're going to end up being a little bit more pushy than you need to be, and they're going to feel that. So just relax, be there to support them and listen to them, and you'll be surprised at how willing people are to actually get vaccinated if they feel your support. Okay, so here we go. This is all new now. We're going to be talking about pediatric hesitancy and specific types of that. And again, the VH guide, as I mentioned last time, is a great resource, so you should check that out after this talk if you haven't already. Okay, so concerns about science. This is the most basic type of hesitancy, I'd say. So people will say, I'm double vaxxed, I can't bring myself to vaccinate my 8-year-old. I don't know what will come down the road, what it'll do to him years from now. So they're vaccinated, but they can't bring themselves to vaccinate their kid. Why would I subject my kid to this unknown experimental compound when COVID in kids is so mild? So I want you to recognize with this statement, this person is saying a couple different things. One is they think that this is an unknown experimental compound. So they're really concerned about what's in the vaccine and that we don't have enough evidence about that. And they're also misinformed about, the harms of getting COVID, right? And then the third one, will this be a yearly vaccine? What about booster shots? This person doesn't like getting vaccines. So, they're concerned about, the idea that they might need it every year, like a flu vaccine, for example. So with these types of hesitancy, don't just jump into the science, okay? Even though these are generally answered by science, you don't want to do that yet. You want to think about where your patient's at, right? Ask those open-ended questions and consider your patient's willingness to hear that type of explanation and how they, what their background knowledge is, their capacity to understand stats and data, because you want to gear this to where they're at. And again, you're always wanting to be an ally and to validate first. So you take that step, right? Then when it is time to share, you're going to ask permission again to share the science before jumping into facts. You want to try to use simple, relatable metaphors, okay? To explain the vaccine development process. You can explain the mechanism. Almost all vaccine questions can be answered with the mechanism in mind, okay? So at the end of the day, it's really important that the patient understands what's going on in terms that they feel like are digestible and understandable. So I think, you're always going to be validating, you're always going to be being an ally, and then you're almost always going to explain the mechanism of the vaccine, at least for 1 minute, just so that the patient understands what's going on, and it will answer 100 other questions in their head if they understand the mechanism. And when they ask you further questions, you can always relate it back and be like, remember, you're creating antibodies. That's the only thing that's staying with you. Those are like little soldiers. You can always bring it back to your mechanism, your metaphors, and you're going to create a common language with the patient. So one way that I could also answer all of these types of questions is if you have, depending on your rapport with the patient, you can say something like this, like, you've known me for quite a long time, but you might not know actually how much of a science nerd I am. And I'd actually be really excited to share with you the whole story of how this vaccine came to be, how it works, how we got here so quickly, because it's a really cool science story. And that way you're just showing that you genuinely want to share about this and they don't feel threatened and you're an ally with them, right? And you also are validating their concerns. It's understandable that you're concerned if you don't have a deep understanding of how this all works. So that's the general approach for this type of hesitancy. Okay, now we have people who are influenced by rumors, conspiracies, or misinformation. They might say, I don't trust the government telling me what I need to do when they haven't led us down the right road, in my view, to this day. Or I don't think Big Pharma has our best interest in mind. They're all about making profits. Or why haven't we used ivermectin to help treat COVID? Okay, so again, reaffirm your position as an ally and as a trusted source. You're different than the government or Big Pharma, okay? You are a person that they know, that they're hopefully looking in the eye, speaking to. You need to really differentiate yourself from those other, entities that are kind of mysterious and, Big Pharma, the government. You're a person right in front of them. So you need to really emphasize that. You have a perspective as a healthcare worker or a provider that's different than the patient's, and you want to share what you've seen and what you know, right? So, for the first one, I would align myself with the patient. And I think it's reasonable if they are someone who doesn't fully trust the government, that's okay. There are instances where the government has not deserved our trust. So it's reasonable to say, I'm with you. The government hasn't necessarily earned our trust, but you know me and my training and that I know how to analyze research studies and understand science. So let me explain this to you, because I've done my own research on this. And actually, in this case, the guidelines that the government is issuing actually are in our best interest, right? So we're taking every single thing individually. And in terms of big pharma, yes, big pharma or the pharma companies are motivated by profits, unfortunately. However, a good product is one that works well and is safe. So in this case, the incentives are aligned. And what we have, with what we as a society need right now, there's actually 20 to 30 pharma companies that tried to make a vaccine, and we only hear about a handful of them because most of them didn't work out. So Health Canada has really strict criteria and safety checkpoints that the vaccine need to meet to get approved. And that's what's happened, right? So that's why we know about Pfizer and Moderna, because turns out theirs actually worked. And we don't know about all the ones that didn't work. And then regarding the ivermectin, this is an interesting one for those of you who don't know. There was a meta-analysis done. So they looked at all of these different studies about ivermectin. And let's say there were around 30 of them, okay? First of all, they looked at the methodology about all these different studies, and half of them were thrown out right away because the methodology was very weak. Then there were another half that actually had good methodology, and they looked at the results and showed that a handful of them showed that ivermectin did not work, and a handful of them showed that it did work. Then they zeroed in on the ones that showed that it did work because they had good methodology and it looks like ivermectin works. So what's going on here? Well, they looked at where these studies took place, and they took place in places like Bangladesh and Egypt and parts of the world that actually have parasites endemic to those areas. So actually, a lot of the population already has parasitic infections or worms in their system. So giving them ivermectin when they had COVID actually treated the parasitic infection, which strengthened their immune system to fight COVID. So that's why it looks like ivermectin works. But if you live in Canada, you probably don't have a parasitic infection. It's extremely uncommon here. So giving ivermectin is not going to be helpful. So if you explain this whole meta-analysis, it will actually validate people who think ivermectin works, because it does actually work for certain subsets of people, but probably not the patient you're talking about. And if they happen to have a parasitic infection, then sure, treat them with ivermectin. So this adds a bit of nuance to it. That's the story of what's going on with ivermectin. Now you know. Okay, so now there's some people that actually are completely unconcerned about COVID or the pandemic. They'd say it's been blown out of proportion. It's just a bad flu. I know someone that had it, they didn't get it bad. It's only affecting older people. I'm pretty young, so I'll be fine. So here, once again, you emphasize that you are a healthcare provider in the community, and you have a different perspective about the severity and impacts of COVID. You also can think about the fact that if they're unconcerned about the pandemic, they're probably extra upset about the lockdowns because they see them as completely unnecessary and they want to get back to normal ASAP. So getting vaccinated is actually going to help us all get back to normal. So we're all on the same team here. Let's get vaccinated. Let's get back to normal. Vaccines can not just protect them, but it can protect the people around them, their loved ones. So even these people might be unconcerned because they're young, they have parents or grandparents or community members that they might want to protect. And you can appeal to that in this case. I would not appeal to that as a first reason, not in our Western society. Maybe that might work more in a collectivist society. Here, I would avoid lengthy debates about facts and stats and really stress the ease of access and the high safety profile of the vaccines. So these people think, people thinking in this way might think that COVID's not a big deal, like my body's strong, this and that. Well, then they might not be the same people who are as concerned about the vaccine hurting their body either. So just steer the conversation to, okay, then what's the downside of just getting vaccinated? We're gonna, we'll all be able to move forward faster and reopen in that sense. Okay, so Now there are parents who are concerned about development or puberty in their child. My child's about to go through puberty. I'm worried about that the vaccine could affect their development. Or how do you know this vaccine won't affect my kid's fertility? You don't have the evidence yet. Okay, so first step, always validate, okay? This is actually a legitimate concern. If you're a parent and COVID has never existed before, COVID vaccine has never existed before, you want to make sure your kid develops safely. It's all understandable. So empathize with those concerns. Be an ally, listen to them, give them some time, give them some empathy. Then you want to explain the mechanism. The mechanism is going to help you answer this question if you haven't already explained it to the patient. Lack of evidence, I would say that's a relative term, right? We already know that COVID can cause long COVID syndrome, which means you have brain fog, headaches, fatigue, last months and months. This can happen in up to 20% of cases. And that we know would impact a child's schooling and development. And not to mention multi-inflammatory syndrome in children and other problems caused by COVID, right? There are actually children in the ICU with COVID. So you don't want that to happen to your kid. So there's evidence around all of these things already. And we know that the vaccine has been around for 1.5 years already. It's a pretty long time. And especially given the amount of people who've gotten the vaccine, which is like billions at this point, we now know that adults and children have tolerated it very well. There's no indication of any impact on development. Mechanistically, it does not make any sense that it would impact puberty or development in any sense. So I would go back to the mechanism, because once they understand the mechanism, they would understand that the only thing remaining in your body are antibodies. And that's the same thing that would happen if you got any type of infection. And that is not going to affect fertility, development, puberty at all. Okay, now there's some people who are concerned about the risk or unconcerned about the risk of COVID in children. So half of my kids' classmates had COVID and they were all fine. Kids barely get sick from COVID and the death rate is so low. Why bother vaccinating? My kids have already had COVID. Why do they need the vaccine? Are you saying that I should expose my children to this vaccine for the sake of the greater population? Okay. So the thing is that if you're completely unconcerned about COVID in your children, the last thing you really want, right? You obviously care about your child. The last thing you want is for your kid to get sick from COVID. And then at that point, you're going to really wish you got vaccinated. You don't want that to happen. How do you prevent that? You get vaccinated. Then you can, have the no regrets mentality. I got them vaccinated. You did the right thing as a parent. You can also highlight that there's an uncertainty in the amount and the duration of natural immunity. So we're thinking like 3 to 6 months. There's a lot of mixed evidence on that. Getting vaccinated, you have immunity that lasts longer than that. It's more robust. Each person's immune response to COVID is variable. It depends based off of their immune system, their health, how COVID stimulated their immune response. It makes it difficult to predict how much immunity a person will get from natural infection and how long it will last. But we do have a lot better evidence on the immunity that is conferred from a vaccine. So it's better to get the vaccine. Okay, you don't have to risk anything with COVID either. And regarding this last question, I would say don't tell them to do it for the population benefits. It actually weakens your argument from a parent's perspective. I would say that that's a bonus. It's a bonus to, that you're benefiting the population. But parents are very focused on their kid and they want to do something for their kid. They're not going to give their kid a vaccine because it's going to help other people, even if they say that, okay? that's just a bonus thing. They are doing it for their kid, and that's the way that people think in our society. So you need to tailor your communication for their frame of mind. Okay, so you as a parent, you should vaccinate your kid because it's going to protect your kid from getting COVID and the effects of COVID. However, if they have a kid that is from 0 to 4 years old and it's their kid, then that argument of protecting someone else by getting your kid vaccinated is valid, because that kid is going to be protecting their younger sibling by getting vaccinated. And the parent will care about that because it's their own kid. Okay, so that's the way that I would approach that. Okay, so now concerns about rushed vaccine approval. How can you know it's safe when the vaccine is not fully approved yet? Okay, so the vaccine is approved for emergency use authorization by Health Canada, and that means that they've deemed the benefits outweighing the risks at this point, and we want to proceed with vaccinating children. And this decision obviously is not lightly made. There's preliminary studies that were done that informed this decision. It was not just made out of the blue. They looked at hard evidence, and we had a whole committee of people really looking over this very closely. And these are the best doctors and scientists we have in the entire country that are working on this. And then the data suggests that not only is this vaccine effective, but it's also extremely safe. And we're going to get more into that in a bit. And after approval, that it doesn't end there. There's ongoing surveillance, and that's further confirmed that what we've already seen, that the vaccine is safe. We also have a monitoring system that I just mentioned that is looking at all of our vaccines, and AstraZeneca is a great example, and I would encourage you to use this example. So with AstraZeneca, if you remember, in about April, May of 2021, we started noticing through our monitoring system that it had a higher chance of a blood clot occurring than with the mRNA vaccines, such as Pfizer and Moderna. And because our monitoring system captured that, Canada made the decision to pull back AstraZeneca and just withhold it. And because we had enough Pfizer and Moderna, that we could just continue giving that, which doesn't have that side effect. Even though that side effect was very, very rare, we still decided to just proceed with caution and give the mRNA vaccines. Whereas other countries, such as the UK, they didn't have access to Pfizer and Moderna, and they still deemed the benefits of AstraZeneca to outweigh the risks. So they continued giving it to their population. So Canada is very conservative in that sense, which is really good, because now, we're able to do things that are extremely safe. And that's because we have the options of having multiple vaccines. So we can really give safe vaccines, and that this confirms that our monitoring system is working super well. Okay, so this is my myocarditis slide. People have questions, particularly in younger age groups, about myocarditis. So a few things to know. This is the update about the 5 to 11-year-old vaccine. So I'll tell you a little bit about the study that they did. They had 8 million children who had the vaccine, the Pfizer vaccine, 5 to 11 years old in America. Out of the 8 million children, only 11 of them had myocarditis. So that's close to 1 in a million, which is extremely low. And all of those 11 children had a full recovery and are doing well. So this is exceedingly rare. This basically puts this issue of myocarditis to bed. And conversely, if you don't get vaccinated, that increases your risk of COVID, obviously. And as you can see on that slide right there, you have a 16 times higher risk of myocarditis from COVID than from the vaccine. And now that number is much higher because, as I mentioned, the vaccine gives you a 1 in a million chance of getting myocarditis if you're from age 5 to 11. And that hockey player that you see right there is Josh Archibald for the Edmonton Oilers. He's the only guy that didn't get vaccinated on the team. Turns out that he got COVID, and then because he got COVID, he got myocarditis. So it's very ironic, and that might be a story you can share with someone if they know or care about hockey. Okay, so now we've made it to the interactive portion where you get to put your skills to the test amongst your peers and colleagues, and we can make this interactive and fun. So we're just going to type down in the chat these two questions so that you have them saved, and then we'll get you into breakout rooms. You'll be with one other person or maybe two people. So you'll have a partner A and B, and the first one will be partner A will get to be the health provider, and partner B will be the patient, and then you'll switch. So the first question is, why would I subject my kid to this unknown experimental compound when COVID is so mild? And then the second question is, my kid is about to go through puberty. I'm worried the vaccine could affect their development. So Karen's just going to get us all into breakout rooms, and I'll type this into the chat so you have it saved, and then we will we'll give you about 10 minutes to try that out, and then we'll reconvene and take it up. Karen?
Breakout rooms are open now, so please feel free to join in.
And you just remember the question, because you might not be able to see it later. Okay. So question one, why would I subject my kid to this unknown experimental compound when COVID is in kids is so mild? Do we have any volunteers? Just share with us how it went in your group, maybe different ways you talked about it, and maybe any questions that you have for me.
Kimberly, can we volunteer you?
Yes, of course. Okay, so I would be responding. So, Mr. Jones, I definitely, I understand. I'm grateful that you're taking the time today to talk with me. I think that it's great because you're coming from the perspective that you really care about your child, and you want to make sure that your child is healthy and developing well. But I also just wanted to clarify some things that you had mentioned earlier. So in terms of this being an unknown experimental compound, I just wanted to reassure you that there has been sound medical and scientific, there's been proven scientific and medical evidence showing that the COVID vaccines are safe in children. It's not actually an experimental compound because one thing you need to understand is that research regarding COVID vaccines actually started many years ago, back in 2005, when we had the SARS outbreaks. And so this is not something that's new to us. The COVID vaccines have been building upon a lot of medical and scientific evidence from many years ago, and they have been proven to be safe and effective within children. So I know you had said that you feel like it's an experimental compound, but I just wanted to reassure you that there is sound medical and scientific evidence proving otherwise. In terms of when kids get COVID, they have mild symptoms. I just wanted to clarify and also reassure you that even though children, some of them do get mild symptoms, some of them unfortunately get very severe symptoms as well. And one of the things that we are concerned about as healthcare providers is the long-term effects of COVID-19 on children. So we name it as it's an umbrella. We call it long COVID, but more specifically, we'll see children with brain fog, irritability, chronic fatigue. And right now, as children are in their developmental stages where they really need to be engaged when they're in class and really being able to develop well, we want them to be at their best. And so we want to prevent children from getting COVID-19, even if they do end up with mild symptoms, because there is the 20% chance that they might end up with long COVID. So I just wanted to just reassure you that I'm here to support you in any way. And if you have any further questions, feel free to ask me.
Awesome. Okay, thanks, Kimberly. So, what she did there was, first of all, very empathetic tone of voice. She took time to validate at the beginning that the concerns are, valid. And as a parent, that's totally normal to have these questions and concerns. And then she broke down this question into the two portions. As I mentioned earlier, there's one that it's like this experimental compound, so it's not trusting what's in the vaccine. And then secondly is this, this person has an understanding of COVID in kids being mild, but that disregards the risk of long COVID and other complications of COVID. So well done, way to break those things down. Awesome job, Kimberly. And let's just move on because we're short on time and I have a little bit of bonus material for you. Let's see if we can do the second question. And the way Kimberly did it is awesome, and she took on the first person. But for the next one, let's see if someone can just kind of say the points that they would make, because in real life, when you actually make those points, understandably, it will take a lot longer to actually, take the time to validate someone and actually explain these things in great detail, which is more than the time we have left. So for question 2, my kid is about to go through puberty. I'm worried the vaccine could affect their development. Can we just have a volunteer that in 30 seconds can just break down the points they would make in response to this query?
I could go ahead.
Awesome.
Sorry.
Go ahead.
So again, the same thing of just confirming or again, validating their emotions, their feelings, understanding that as a parent, you do want to go ahead and look out for your child. Then moving forward to kind of guiding them towards like resources or articles or any FAQs that could help them answer these questions. Another thing that in our breakout room that we spoke about is maybe even directing them to their child's pediatrician or doctor to maybe also have these concerns, I guess, reviewed and like spoken to about.
Yeah. And so, so validate, right? Mm-hmm. And then this is where you go into the mechanism, right? So briefly, the way I would describe this is you talk about the mRNA, and I talked about this in the previous talk, but the mRNA goes into the cell, and mRNA cannot affect the DNA because DNA stays in the nucleus of the cell, and mRNA cannot go into the nucleus. Okay, so the mRNA tells other parts of the cell to make the spike protein, and then within a couple hours, the mRNA is degraded, so it's gone. And then the only thing you have at that point is spike proteins that your cells are producing, and they circulate around your body, and your immune system notices this spike protein. And by the way, this spike protein is the same protein that's found on the outside of the COVID virus. So now your immune system is reacting to this because it's never seen it before. It's a foreign substance, and it starts making antibodies, which are little soldiers of your immune system. And they're like a puzzle piece that fit onto the spike protein. And you make so many of these antibodies. And so when the real COVID virus shows up, those antibodies swarm the virus because they recognize the outside of it. And that virus cannot infect you as easily. And by the way, the spike proteins themselves also get cleared from your body in a few days. So the only thing that you are left with in the medium to long run is only the antibodies that your immune system has produced. And that's the point of the vaccine, because that's what confers immunity to you. So those antibodies are normal things that your immune system is always producing. Even right now, your immune system is producing antibodies to different, substances that it has come into contact with, and that has no impact on development or puberty or anything. So your kid will be fine. So that's the mechanism that I didn't mention in detail today, but that's what you could say. And then, as you mentioned, talk to a trusted provider. So whether that's the patient's family doctor, pediatrician, or the VaxFacts Clinic, where we have doctors ready to speak with them directly about this, and our availability is really good. So thank you for that. Now I just have a couple bonus rounds, okay? So let's try to rip through this real quick. because I think this will be helpful. These are a few questions we thought of. Okay, so we know that other vaccines increase the risk of autism. How do we know that COVID vaccine won't do the same? So this is a big misconception, right? Vaccines do not increase the risk of developing autism. This came from a fraudulent study in 1998 by Andrew Wakefield, which was subsequently redacted. And the concepts are still unfortunately linked in the minds of some people. So it's really important to clarify this. No autism, okay? No, not true. Next question, is the vaccine safe in pregnancy? Yes, the vaccine is safe in pregnancy. Vaccination of pregnant individuals is advised, especially because increased negative outcomes of pregnant patients who have COVID. So they have higher risk of hospitalization, high risk of ICU, high risk of death, high risk of complications to the baby. So including preterm labor. So yes, pregnant individuals should be prioritized for vaccination. Next question, when should my kid get the second dose? So for kids, NACI said 8 weeks initially, but then Omicron came. So now, you know, the reason why NACI said 8 weeks initially was to just improve vaccine tolerance in terms of side effects, you know, enhancing the booster aspect of the second dose. Those things, you know, given Omicron, we would generally say you can go ahead after 3 weeks or about 21 days, go ahead and get the second dose, okay? It's all about the context we're in. So if it's been over 3 weeks, they can go ahead and just get it now. Oh, another round of bonus questions. Okay, so my child received their second dose today. Should I wait a couple weeks before sending them back to school to ensure they're immune? So we've had some patients ask this to us, which I think is interesting. So they want to maximize the conferred immunity by waiting 2 weeks after their second dose. You know, there's already significant immunity after the first dose of the vaccine. And remember, we're actually coupling this with safety interventions like mask wearing, hand washing, that kind of thing. So I think that it's reasonable to return the child to school right away. The vaccine is 91% effective 1 week following the second dose. And so this immunity will continue to build during that initial week back. There's no right or wrong answer to this. It's up to the patient or the parent's preference, but I would say it's safe to go back to school right away. Next question. My child just recovered from COVID. When should she get vaccinated? If your child's completely unvaccinated, then they probably should start their primary series 2 weeks after the resolution of symptoms. Okay. And oh, whoa, a third bonus round. Okay, these are some rapid fire age-related questions. My kid is 11, turning 12 later this year. Can he receive the adult vaccine dose? No. The adult Pfizer dose is approved for use in individuals aged 12 and over only. My kid is 4 and turns 5 later in the year. Can I vaccinate her now? No. Unfortunately, kids aren't eligible for the current Pfizer pediatric vaccine, the 5 to 11, until the day they turn 5. But hopefully the 6 month to 4 year vaccine will be approved soon. So hopefully they can just get that and they don't have to wait till the day they turn 5. My kid is turning 12 in a month. Should we wait to vaccinate and give the adult dose? No reason to wait. Either dose will work for this child. So just give whatever they're eligible for at the time. So in this case, if this was my kid, I would just give them the 11, they're 11 right now. So give them the 11-year-old dose today or tomorrow, and then they'll come back. And if they're 12 at that time, they get the 12-year-old dose and they're fully vaccinated. Boom, done. That's it. Thank you to all of these excellent people and organizations. And lastly, this is our last slide. This is our service, the VaxFacts Clinic. Please go ahead and book an appointment. Please share this with your patients. or your family or friends, anyone who's hesitant, we have doctors available. We have several appointments this week still. So the calendar you'll see on the website, please book an appointment, and we'd love to talk to you about the vaccine. So thank you for having me. It's been a pleasure, and see you at the next VaxFacts talk. Thank you. Bye.
Thank you very much, Latif. That's a wonderful session. We really appreciate this. And this brings to a closure today's specially targeted education program related talk and given by Dr. Latif Murji. Thank you so much. Have a great day. Bye-bye.